thank you all for being here. It's great to be at a Brockville Chamber meeting in person. These meetings of having the MP, the MPP, and the mayor, are legendary. And it's been far too long since we've been able to have all three of us in 3 consecutive months giving an address to a group like this. So just thanks so much for coming. Now, some of you who have been here many times know that of the 3 politicians, I have the worst record in terms of weather. So we've had a snowstorm, we've had an ice storm, we've had sleet, we've had, as my predecessor Bob Runciman would say, a corporal's guard here to greet me, right? So, it's great to be here, and I think I've got the sweet spot, right? Because in December, Pam reached out and said, Steve, you know the drill, pick the dates. And I just had a couple of protests at the office, right? So I was trying to think, what would be the perfect day to have a speech? Valentine's Day. It has to. It's perfect, right? So, and we've got some carnations for all of you, including for my Valentine, Deanna. It's great that we could have breakfast together. So, it's great. My love. But I want to tell a story because Deanna and I are very fond of your parents, Jamie, and everybody knows Chris is a bit of a jokester. So, and at one of my councils that he sat on, he sat beside a gentleman that many people know in the room, the late Ray McClure, who was an ex-Brockville police officer, really by-the-book guy, and he was really by the book when it came to a council meeting. And he never wanted anything that wasn't on the printed page to be done. So one day, we had a council meeting during Valentine's Day. And listen, that's, your worship, Augusta Council, that's not a great day to have a council meeting. You want to make sure you get your butts out of that chamber the second you can to be with your loved one, right? Pretty simple stuff. So at the very end of the meeting, Chris stands up, says, your worship, point of order. Yes, at that time, Alderman, that was what the name was, right? Not councillor, Alderman Puttycombe. Yeah, I'd like to ask unanimous consent to bring forward a motion without notice. I don't even remember what it was. Right away, Ray, you could see him vibrating in the chair, right? Like, I want to get out of here, it's 8 o'clock. And he was literally losing his mind at the meeting about how we could delay on Valentine's Day. So finally, with much coercion, Ray agreed to Alderman Puttycombe's motion, and Chris literally put his briefcase on his desk, popped it open, took out a carnation and said, Alderman McClure, will you be my Valentine? Ray's face was redder than the red carnation. But after that, everybody was always worried about your dad. When Alderman Puttycombe had a notice of motion, you were always wondering who was he going after, right? Is it me? Is he coming after me? But it just reminded me of that story, and it was a Valentine's Day council meeting. So I just want to, first of all, I want to take the third leg of the speech at the chamber. Next month, I want you to all come and hear his worship, Mayor Matt Wren, his speech here. What's the date? 21st. March 21st.
No one's ever paid to hear me speak before. So
well, there's a first for everything. So, and I want to thank the entire Augusta Council for being here. You guys get the gold star. You're now my favorite municipal council in the riding because you're all here. So I want to thank Mayor Jeff Shaver, Deputy Mayor Adrian Winans, and Councillors Tanya Henry, Michelle Bowman, and Henrik Payne. So welcome here, and just give all of our municipalities a round of applause. I also want to welcome Josh Bennett, who faced off with me in the elections. Great to see you, Josh. And I joke with Josh, he's in the best seat, so he can get out and I won't see him, right? So in case he wants to leave. But it's just great to see you, and Happy New Year to you too. So, and then finally, yeah, let's give Josh a round of applause. And then finally, Angela and the team at Allstate. So you guys have been my sponsors for every time I've spoken. Angela and I first met when I worked for Bob Runciman, and she opened her office. And Bob was at Queen's Park, and I brought his scroll because we love our scrolls in politics, and just really appreciated meeting you that day and seeing your new business. Really, what's always struck me, and I've told you this before, was your enthusiasm and just the fact that you're such a genuine person. So just thank you for being you, Angela, and thanks for always being there for me. So let's give it up for Allstate. So a lot's happened since we were here. A year ago, we had the municipal election, which returned both existing members and some new faces. So we had a pretty good blend of change and continuity in the riding. I want to take this opportunity, not just as MPP, but as minister, to thank everybody who put their name on a ballot in all 444 municipalities. It's pretty tough going out there, especially in the times we live in with social media and lots of other stuff, that we've got so many really high caliber men and women who have decided to put their name on a ballot. So I wanted to say that at the start. It's great to have the councillors and the mayors that are here, but really it really means something to me when people get out there and knock on doors. And it remembers back 40 years ago when I did it as a young candidate for mayor, where I didn't have any experience, and I used the door as an opportunity to really understand the issues. So it's a really good thing. Mike, okay, I'll try to stay focused. So I also have had plenty of opportunity as minister to get out and meet councillors from across the province. So we just had the Rural Ontario Municipal Association Conference, and really good feedback from municipalities about what they need moving forward in the future. I'm also proud that since we last met, we had a provincial election. I'm proud of the campaign we fought last spring, a very forward-looking, positive message that really prioritized our future and really help our province both recover from the pandemic, but also accelerate some of the issues that are most important to the people of Leeds, Grenville, Thousand Islands, and Rideau Lakes. And great news last week. The riding boundaries, the federal riding boundaries, were proposed to be changed. And, as I'm not going to say anything inside the room that I haven't said outside the room, but they were pretty wacky boundaries. It really carved up Leeds, Grenville like I'd never seen before. So, MP Barrett and I and many others, including a number of mayors, presented to the Electoral Commission, and it was very satisfying on late last week to find out that the riding, the entity we call as Leeds Grenville, or the corporate riding of Leeds Grenville, Thousand Islands, Rideau Lakes, because all we did was lose the "and" in the riding. So I always say it's long name, amazing service from your politicians. But all kidding aside, it was really good that we aren't having the riding carved up. Like literally to have Elizabethtown here and Kitley there, to have Rideau Lakes, Westport, Merrickville in another riding, and then to have people in Kingston snatched from their city and popped into a 401, 416 riding, just really didn't make some sense. So appreciate everybody who made deputations, keeping Leeds Grenville whole. So it was great news, and I know MP Barrett, if he spoke this month rather than last month, would do the same. Kudos to everyone. I'm looking over at this table. In terms of issues in the riding, healthcare is still number one. Health HR, to address the shortages of doctors and nurses. I was at Joint Services Committee of all of our mayors last week. The second time I've been there since I've been reelected, to talk about the importance of healthcare and HR recruitment. Big issue, every riding, in every community, not just in Ontario, and not just Canada-wide. This is a global issue, especially in North America. There's a lot of competition, and my message to the mayors was we all need to work together, right? We need to work with our healthcare facilities. It's got major implications to public health in the riding, but also our riding's economic health, since we all know that a stable healthcare system is really critical to attracting workers and jobs to the riding. The challenges that we have in the healthcare system can't, unfortunately, be fixed all at once. We've got to put a plan in place, and I think Minister Jones, many of the things that she's announced recently and some of the things that have come forward, especially with the meeting yesterday with the Prime Minister and the Premiers, really going to be exciting in terms of of provinces being able to deal with some of the challenges. Although it's not everything the provinces wanted, I think it gives us an opportunity to build upon some of the successes that we've had. And one of the successes that we had last year was the fact that the government announced more than $825 million in funding to hospitals across Ontario. Our funding forecast for infrastructure investments in the next 10 years is about $40 billion. Late last year, we were able to make an announcement of $8 million for the United Counties of Leeds and Grenville for a program that's near and dear to my heart, the land ambulance program. But we've really had the community paramedicine program being expanded, which has been a real game changer. The additional $680,000 in health infrastructure funding we were able to deliver to the BGH, and you know, the recent announcements about improving healthcare for residents, things like pharmacists. You know, that was a very quiet announcement that was made effective January 1st, something that I've heard from pharmacists for years about ensuring that their scope of practice is increased. And just in the first month since we opened that up, 65% of pharmacies took advantage of being able to provide prescriptions for those ailments. You know, some 40,000 prescriptions with some 31,000 patient visits really is a game changer. And that, coupled with community paramedicine, which takes people away from the emergency room, allows them to be treated at home, plus, you know, making sure that we can accredit people from other provinces and other territories right away as of right. Some of those things are direct steps that the government's done to really alleviate the backlog of both elective and day surgeries. And I'm going to be the first one to acknowledge that these measures aren't going to solve every issue related to healthcare on their own, but I can assure you that the government is working hard to both improve access for care, but also to ensure that we listen to our professionals on the front line so that we can make good informed decisions. I'm going to continue to advocate for rural areas and smaller communities like those that I represent here in Leeds, Grenville, Thousand Islands, and Rideau Lakes. The example I'll give you is the situation in Maori-town, right? The government created virtual care in the middle of the pandemic because docs couldn't see their patients. As part of the OMA agreement with docs, we wanted to get docs back in their office. So, you know, while virtual care is here to stay, you know, we created it during the pandemic, we're keeping it. We want docs seeing patients back, you know, in their offices, but we're not solely closed on that. So the importance of expanding nurse practitioner-led clinics for underserved areas like Maori-town or like Leeds, Grenville as a whole are very important. The assessment center, right? You know, the assessment center, you know, use Deanna as an example. You know, a doctor referred her to the assessment center, saw a doc, got assessed for pneumonia, got treatment. You know, really that is the beauty of having that assessment center. It's not just for COVID. You know, there's docs there and doctors in the riding know that it's a resource. So, you know, that was something that yesterday I, you know, corresponded with the Ministry of Health and said, hey, do you know how great our assessment center is? You probably should consider, you know, keeping it open. And those things, along with the bigger things, you know, I think are really trying to ensure that we connect people and that the care is available where they need it. So, you know, I had a great discussion yesterday in my office with Mayor Haley from Front of Young, and you know, I'm pretty encouraged with some of the other conversations I've had with healthcare professionals since we announced that connection to care plan. I've had calls from a number of nurse practitioners, a number of interested parties that want to help us with our underserved patients, people that don't have a family doc. And I remember what it was like, right? When I first worked for Bob Runciman in 2006, that's all the three of us did in the office, all day, every day, for that first, you know, 3 or 4 months. All we did was take calls from people who didn't have a family doc and didn't want to go to Emerge, right? They wanted something else. So we've come a long way, but we haven't solved it yet, and there's lots to do. The other thing I want to talk about is just a couple of things that the government has done during the pandemic, and we've seen a real resurgence with the Ontario Trillium Foundation. We've been able to give, you know, COVID-based funding to a number of municipalities to help with things like festivals that were having a challenge because people weren't able to get out and enjoy it the way they used to, and including it was about it was some significant dollars, but also significant dollars for infrastructure. We made decisions not just for recreation facilities, but we need to have some hard infrastructure built in our cities, towns, townships, regions, and counties. And to be able to have a program like the Ontario Community Infrastructure Fund, or OSIF, really was a game changer. We doubled it as a government. It was more than $1 million for Brockville, more than $4 million in the United Counties. And I had a chance to tour some of the sites the other day, really impressed with the work that municipalities are doing, both on the infrastructure side, but also on some very innovative projects for the Ontario Trillium Foundation. We've been able to help some very small facilities like Legions that were really in tough over the last 3 years and needed a bit of a boost. So, the funding I know is being put to really good use. We just need to build upon some of the success. So for the last few minutes, I just want to talk, just given the importance of housing, to talk about the ministry, the housing side, both as the MPP and also the minister. And the elephant in the room always when you talk about housing is the housing supply crisis. I'm sure many of you have heard about the bold action that the government's taking, including our pledge that we took to the people in June that we wanted to build 1.5 million homes over the next 10 years by 2031. To support the construction of these homes, we've made some major reforms to municipal government. We've passed 2 housing supply action plans in the last year alone, and we're not stopping. The government promised that it would deliver a new housing supply action plan each and every year under a re-elected government under the leadership of Premier Ford. So this is not a one and done. There's no magic bullet. There's nothing that we can singularly do that's going to snap my fingers and solve the housing supply crisis. We're working hard, but the challenge is it's being portrayed as a big city problem, and that's true. There is a challenge in our biggest cities of Toronto and Ottawa, no question. But really, when you look at all 444 municipalities, no community is really immune. Increasingly, we've got residents from big cities that look further and further afield to find a home, and the housing crisis is going to be felt, right in those smaller communities that people are moving to. The other challenge is the fact that when we picked the 1.5 million homes, we've got other experts that have been out there that have given us new data, right? Almost immediately after the election, we've had time to look at the CMHC report that probably says it should be 1.7 million. Plus, you've got the decision by the federal government, which is a great decision, to bring 500,000 new Canadians to our country. I know that the majority of those newcomers who we want to welcome to our cities and our towns and our townships, the majority of them are going to come to Ontario. So if we look at, and the number that's been thrown around is 60%. So you add 60% to an already difficult housing supply action plan, it's going to be a really challenge. And that's why we have to implement, bold policy. In 2022, last year, we had nearly 100,000 housing starts. It wasn't as good as 2021, but it was still the second highest year for housing starts in over 30 years. I'm proud to report that last year in 2022, there were about 15,000 rental housing starts in the province, which is the highest number on record. And I know we want to continue to work together to make housing a priority, but you guys can do the math. We were talking with the home builders just before, and 100,000 starts times 10. You guys are better in math than me, right? We're not going to get 1.5 million or 1.7 million. We've got to continue to build upon the success that the government has had, and it's difficult, right? We're dealing with our municipal partners right now, and they're worried about dollars, which is what they've been worried about over the last 3 years because of COVID. So we've got to continue to work, continue to consult, but time's a wasting. And I want to make sure that I look that young couple in the face who right now don't have a hope for home ownership, and I want to give them hope. I want to make sure they know that they've got a government that's part of a bigger scheme of ensuring that we work with municipalities, we work with the federal government, we work with all the partners, whether they be a private sector company, whether they be a nonprofit, whether they be a public housing provider. We need housing of all types, of all shapes, of all sizes, of all price ranges, and we need to have cooperation. So I'm just going to end by thanking everyone for giving me this opportunity. I want to wish all of you happy Valentine's Day. Look at the sun. This is a very Steve Clark characteristic day to have a chamber speech. Nobody's got galoshes on. There's no shovels waiting for you in the parking lot to dig out of your car, which I think happened one year. I just look forward to continuing to represent you at Queen's Park. The legislature goes back just after Family Day, so we'll be back at Queen's Park for another sitting until probably early June. Lots on the plate, lots to work with the municipalities, lots to work with the federal government, but also lots to make sure that we work with the business community. And again, I want to close by thanking Pam, her board, and her membership at the Chamber. Pam just sent me the economic report from the Chamber, the economic outlook, and while there are some bright lights, there's also a lot of work to be done. There's a lot of businesses that are still struggling coming out of the pandemic, and I appreciate the partnership, the advocacy, and the ideas that the Chamber has given me, not just this year, but every year since I was elected in 2010. So just thanks so much. Happy Valentine's Day, honey.